Staphylococcus aureus is one of the most commonly encountered bacteria in clinical practice. There are many antimicrobial agents and hygiene measures in order to prevent Staphylococcus aureus infections, yet it has remained an important community or hospital-acquired infectious agent. Methicillin-resistant Staphylococcus aureus, also known as MRSA, usually causes healthcare-associated infections. It has also emerged recently as a cause of community-acquired infections. The novel antibiotics linezolid and daptomycin can be new options for treatment, but they are not the best option due to their high cost. Rapid and low-cost laboratory identification of MRSA is important for the treatment of patients. A few methods developed for rapid determination of MRSA are available, but because of the usage of high-cost equipment in those methods, they cannot be used in every center. StaResMet is easy to perform and saves time in the determination of methicillin-resistant Staphylococcus aureus. It is considered that this kit gives an option to clinical microbiology laboratories with limited facilities to detect MRSA earlier. The early selection of an appropriate antibiotic for the treatment of methicillin-susceptible Staphylococcus aureus, MSSA, and MRSA is critical for outcomes. The early selection of an appropriate regime for the treatment avoids the unnecessary use of antibiotics. In addition, early detection reduces mortality, the length of hospitalization, and costs associated with bloodstream infections caused by Staphylococcus aureus. Today we would like to represent StaResMet, which is a new method for rapid determination of methicillin resistance in Staphylococcus aureus. For rapid determination methicillin resistance in Staphylococcus aureus isolates, in this procedure the following steps should be followed. First of all, we have the box of the kit, and there will be solution 1 coming out of it, and the solution 2. Also the procedure of the kit. On top of that, we have the strips. There are 12 strips in order to apply the procedure. First of all, we're going to start with adding 100 microliters of solution 1 to each well that we're going to use. In order to start, we can take the strips in our hands and we can see the arrow side. So it will start from this side to this one. You can see the arrow on top of the strips. And we peel the cover. And then we will add 100 microliters of solution 1 to each well. On the strip, we can see the first well is the growth control well, and the last one will be the sterility control well. Now we added solution 1 to every well that we're going to use. In order to add the bacteria in the wells, we should set the turbidity to 1 McFarland. We are going to use pure culture of Staphylococcus aureus isolates. Now we set the turbidity to 1 McFarland, and now we are going to add 10 microliters of bacterial solution into each well, but we're going to leave the last wells because of its sterility control. In this part, we're going to use each strip as one bacterial test. So each strip can be used for one patient. Now we're going to leave the plate in incubator for 5 hours at 35 centigrade degrees. After 5 hours of incubation, we take the plate out, and now we are going to add 30 microliters of solution 2 in each well. And after we added solution 2 to each well, we're going to leave the plate for incubation 1 more hour. At the end of 1 hour of incubation, it is easy to see the color change in wells by naked eye. The wells with bacterial growth have changed into red color. Wells with no bacterial growth have remained as blue. Accordingly, the last well without growth is reported as minimum inhibitory concentration.